and welcome to the first ever Centre for Digital Transformation of Health Summit. And the key topic that we'll be exploring this morning is how to embed really the essence of digital health research and innovation into the healthcare setting. So this is something that's a really very much a hot topic at the moment. Not only was it nominated as one of the absolute goals of the white paper from the Association of Australian Medical Research Institutes, but also some years ago, it really was something that the federal government had intended. It's taken a few years, and as I was just speaking to Harin this morning, we're working in an environment where it's so important, yet our health systems are so poorly equipped to be dealing and interfacing with this. And so a summit like this really brings together the sorts of experts and problems so they collide in conversation. And that's what this morning is all about. I'm absolutely delighted to see all of you here, and over the last years, it's been a rare opportunity to meet face-to-face and to have discussions like this on this topic. For those who don't know me, I'm Peter Choong. I'm the Sahyu Divine Chair of Surgery at St Vincent's, as well as Head of the Department of Surgery at the Melbourne Medical School. One of my other roles is as Associate Dean Innovation and Enterprise, and I've been assisting a panel of international experts review and help tease out some of the questions of how we can make digital health transformation even more impactful here at the university. Before I go any further, I'd like to invite Professor Jane Gunn, our Dean of the Faculty of Medicine, Dentistry and Health Sciences, to the stage to say a few words and welcome us to this important discussion forum. Thanks, Jane.
Thanks, Peter. And I echo Peter's welcome to this, what I think will be a really interesting and informative morning. I'd like to start by acknowledging the traditional owners of the lands upon which we meet, and the Wurundjeri people of the Kulin Nation, paying respects to elders past, present and future. And also noting that, if there are any Indigenous colleagues here with us today. So I'm really delighted that we're having this first conference, Wendy. It's wonderful to see people gathered here around what I know has been a huge effort by you and colleagues to get the Centre for Digital Transformation of Health up and running. I remember the conversations in 2018 at the whole idea of establishing this centre and some of the aspiration for it. And at the time, it was the aspirations were as enormous as the world could be in all things digital health, and of course the need to transform healthcare. And I'm delighted that 3 years later, we have looked at what has been built, and I hope that you join with me in being excited about what's been happening here. Much of it through quietly happening here through 2 years of lockdown. And let's not underestimate that. But it's led by Professor Wendy Chapman. It is a collaboration between the Faculty of Medicine, Dentistry and Health Sciences, where I'm the Dean, and the Faculty of Engineering through the School of Computing and Information Systems. And I note that, the need for medicine, dentistry and all things health and biomedical to come together with engineering, as we know, is absolutely essential to the future of healthcare. And we're trying to create many more collaborations across those disciplines throughout the university. But this one, I remember the search for the first director and what a global search that was, and being impressed when Professor Wendy Chapman came to visit us and painted for that panel the vision for the centre today. And I still have very vivid memories of that. Wendy, I don't know whether you share those. Sure, terrified, she's saying here, not really. And we basically were asking Wendy to build a critical mass of research excellence in health informatics and digital health. And when Wendy arrived in Australia, she saw quite quickly that what she thought might be there as just a matter of course across the healthcare system and deeply embedded was not. It was missing. It was missing from the health systems that she was familiar with working in the United States. And I can only kind of imagine the challenge that she felt when she realised just how much work there was to do. But Wendy really did set about looking forward and making sure that the things that she put in place and the people that she gathered around her were really going to help make a difference and do research in digital health that was going to benefit patients and communities and the healthcare workforce. And I think that's something that struck me about every conversation with Wendy, that she's very much focused on the future of healthcare and the delivery to the community. And I don't think that Wendy or anyone else I've met that's related to the centre misses that opportunity. So we know that a recent white paper from the Association of Australian Medical Research Institutes highlighted the gaps that we have in getting research into healthcare and the way that we need to do that in this country if we're going to deliver more effective healthcare at better value with a better experience for consumers, carers and healthcare professionals. We still have an enormous way to go, and I think anyone who works in healthcare here, anyone who undertakes research that they know could benefit patients and healthcare systems are really challenged by the difficulty, the absolute, myriad of challenges that stand between what you know could, and you have evidence for being able to assist, and yet it cannot be embedded in the healthcare system. And so overcoming those barriers is essential work for us, and it's really, I think, just really still beginning in this country to be done in a way that it can be delivered at scale and monitored and measured, where we can actually know what the value is that we're getting out of that research. So I know today you're going to hear from people all over the world who are wrestling with these very similar issues. There'll be sharing of ideas, there'll be great discussion, and I hope that you will have those vigorous discussions. I hope that you will challenge us, those of you who are visiting from elsewhere, when you know and can see that things can be done differently, that you will challenge us to hear about what's been happening in your part of the world. But also for the people here that I know are working embedded within our healthcare systems, that you will bring forward what your big challenges are and what you wish would happen and be done differently by those engaged in research and practice. So I think it's only by having these conversations, learning from each other, thinking about the challenges and how we can overcome them, that we're able to take the field of digital health to the next level here at the University of Melbourne and across the country. I want to thank everyone who's giving up their time today to be a part of this conversation. I want to thank the speakers, all the special guests, and now I will hand over to Professor Wendy Chapman, who is going to introduce the speakers. No, I'm handing back to Peter. I'm handing back to Peter. So he's going to introduce the speakers. Sorry about that, Peter.
That's okay. Thanks, Jane. It's great to hear the context for the establishment of the centre and to set the scene for today's discussion. But before we start, I recognise that we will be dealing with technology, so I ask for your due consideration and encourage you to turn your technology to silent, if you wouldn't mind. And whilst you'd be glued to every word the speakers will have and fixed in your seat, should you wish to break away from that urge, the bathrooms are next to the lifts on the left-hand side. There's a lot of interest in the summit, so we will be recording it, and you will find it on the centre's website at the end of the session later this week. And for each of these sessions, there will be a roving mic, and please, I encourage you to be engaged, involved, ask those questions that everyone else wants to ask but doesn't dare ask. Please ask it, stand up, introduce yourself, and the mic will magically come to you. So that's all from me right now, and I take this opportunity of inviting Professor Wendy Chapman to introduce our first speaker. Thanks, Wendy.
It's wonderful to see you all. I see so many familiar faces in the audience. Many I've only met on Zoom, some that we've met in person, and really looking forward to today. I want to say that the center is driven by some stories, as many of you in the audience are driven by these same stories, about the person with asthma who keeps returning to the emergency room, getting a care plan that she finds difficult to put in place, having that information not shared across with her other healthcare providers, not being able to access that information herself, and that frustration and that fragmentation that she feels. Driven by the clinician who has so many ideas about how to better care for her patients, and innovative ideas, but just doesn't really know how to bring them to practice and to the point of care. And by the industry partner who's developed this really cool app and knows that this app could really help patients, but has no idea how to get it into the hands of the health services, how to get an audience with the CEO, how to integrate it with the electronic medical record. And finally, to the researchers who are similarly innovating in developing devices, developing AI algorithms, and really want those things to they don't want to just write papers. They want them to have impact, but that pathway into translation and into care isn't clear. And so that's what drives us as a center. And our center, from the beginning, is focused on these clinical problems and trying to really help at the interface of where the patient touches the healthcare system. How do we really achieve that vision of connected health for the patient? This is a really hard task to digitally transform health. As Jane said, our goal in the center in the very beginning is to really build up the capacity at the University of Melbourne so that we can be partners with our with the healthcare organizations and our clinicians in this really ambitious task. Because we can't do it alone, none of us can do it alone, and we all have our own knowledge and expertise, and the goal is really how do we, and the challenge and opportunity, because leaders see opportunities instead of challenges, that's what I've learned in all my leadership training, is how do we bring all that expertise together so that we can make that happen. But it's not easy because there are a lot of barriers. There's a lack of incentives. We're all judged in different ways. And so we haven't figured out how to do it anywhere in the world. But there are pockets of excellence here and other places. And that's the goal of this symposium, is really to bring together those voices so that we can learn from each other and better know how to help the research that we're doing become translated and become partners, have universities and clinicians and healthcare organizations be partners in this ambitious goal. In this journey and today's symposium and summit, our goal is to bring many voices to the table. And so we have our reviewers that have come to review our center. Yesterday, they had a long, intense day listening to everything that we've been doing and trying to do and hearing from people about how it's going and where the future opportunities are. So we have experts from around Australia and the world who are here, and we wanted that opportunity to learn from them on a broader scale. That's why we created this symposium. And so we have Chris Longhurst, who will be our first keynote speaker, and he comes from UC San Diego and UC San Diego Health. And he's really an expert in how to take innovation and make it real. We have Michael Kahn. Where's Michael? Here. Yes, Michael. And he comes from University of Colorado, Denver, and he's really worked on how do you build the data infrastructure in a health system that will drive quality and improve outcomes. We have Claire Sullivan from Queensland Health and University of Queensland, and she's really that interface of the health system and researchers. She steps over both of those and the clinician, and how do we really integrate them. We have Louisa Jorm, right here, and Louisa comes from UNSW and has built the Center for Big Data Analytics.
Big Data Research in Health.
Thank you, Big Data Research in Health. And she's really built this, infrastructure and national infrastructure to really be able to learn from data. We have Jen Morris right here, and Jen is our consumer advocate, and she brings a lot of experience as a consumer and a patient, but also as someone who is helping investigate and drive patient safety within our environment. And then, who am I missing? Who's our last? Bronwyn. We have Bronwyn LaGrice, and she is the CEO and co-founder of And Health, which is an amazing Australia-wide nonprofit to help small innovators, commercialize their products so that they can have impact. And so she brings the perspective of industry and kind of venture capitalist investment to us. Along with so all of these reviewers will be on panels, and we'll be able to hear from them about the things that they're doing. But also, it's the people in the audience. In our audience, we have people from the center, amazing researchers who we've been able to recruit and build out, and you're going to hear from them near the end about the expertise that they bring. And you'll see that we really are building a diverse team that is better able to partner with you than the university was a couple of years ago. And we have you, everyone in the audience, and such a variety of people here come from hospitals, from government, from the university, who have expertise in research, in healthcare, providing better healthcare, in engineering, in IT, in data analytics, in FHIR. We have the developer of FHIR here in the audience, Graham Grieve. So this audience is meant to be part of the summit, and it's really our goal that this will be a discussion. All right, so thank you for coming, and with that, we will move forward into our first keynote speech.